Software-defined network is a term that's been around for a little while. I mean, it doesn't go back too far, but help us understand the difference between software-defined network and what the alternative to a software-defined network is.
Sure. So you and I both having gray hair, we're used to network concepts like VLANs and Ethernet ports and segmentation. And those are static concepts. Those are concepts where, for example, if you have a printer attached to an Ethernet port in a wiring closet, if a user decides to move that printer, that's very easy for them to do. They move it, and then all of a sudden the printer's not on the network anymore because the configuration associated with that port lent itself to providing connectivity to the printer. And so you move the printer and the printer port, and all of a sudden it's not connected anymore. These are really static concepts. A software-defined network says we need to be able to adapt to the changing conditions at the edge, mobile devices, fixed devices, known users, unknown users, shouldn't really matter. And we need to, at connect time, allow those devices and those users to use some methods for identifying themselves using security protocols, and then connect them to the virtual network that they should be attached to. And so, for example, if a healthcare organization has an in-building Wi-Fi network and they also use our access points to provide remote access for telehealth, the user experience looks exactly the same. A doc will log in, a provider will log in from their laptop or from a mobile device, and their authentication credentials would be the same. Their access to applications would be the same. And that's because the software-defined network concept says, you know what, this user has changed locations, but that's okay because policy says we can extend the network concept all the way to that remote location, to this remote access point. And we can use the internet as a backhaul mechanism to do that. That's fine. Let's nail up a tunnel. Let's tunnel their traffic back to some control point in the middle of the healthcare network and let them get access. And so ultimately, a software-defined network architecture says, let's abstract away the static concepts that we used to use, still use them because we need interoperability, but let's make them software programmable. Let's make them automatic. Let's make the user experience really easy. Let's make mobility a primary outcome.